Thank you for joining us for our ninth episode of HeLPiNG Questions. I'm Dr. Alicia Luque, HeLPiNG Questions host. In today's episode, we will have the opportunity to ask Professor Johanne Paradis our ninth HeLPiNG question. Professor Johanne Paradis is a professor in the Department of Linguistics and also an adjunct professor in Communication Sciences and Disorders at the University of Alberta in Edmonton, Canada. Johanne's research is groundbreaking and absolutely fascinating and focuses on better understanding how children learn multiple languages, especially children learning English as a second language from immigrant and refugee families. Her work on bilingualism in children with developmental disorders, which we'll learn more about today, is especially noteworthy. Please take a seat and stay with us as we get to hear more from Johanne about the role of bilingualism in children with developmental or language disorders. Welcome, Johanne, to the ninth episode of HeLPiNG Questions. We're so excited to have you as our guest and to be able to discover together fascinating scientific facts about bilingualism together. Thank you so much for being here with us.
Thank you so much for inviting me, Alicia. It's my pleasure to be here.
It's really our pleasure. And considering the groundbreaking contributions you've made to help us better understand bilingualism in clinical language populations, we really couldn't think of a better scientist to ask our ninth HeLPiNG question. Should we jump right in?
Absolutely.
Ready? Okay. All right. Then, Johanne, based on your experience, knowledge, and expertise, what do we know about bilingualism or the role of bilingualism in children with developmental or language disorders?
Okay, well, that's a broad question, and I think I will start answering it by talking about what language disorders actually are, because some of them are disorders of just language. For example, there is a disorder called developmental language disorder, where children have difficulties learning language, but they have no other clinically significant conditions. But there's many other kinds of syndromes and disorders children can have that have broader effects on their development. But along the way, they also cause difficulties in language learning. So some examples might be autism spectrum disorder and the disorders that come along with intellectual disabilities, such as Down syndrome, Fragile X syndrome. And then there are children who have speech sound disorders, difficulties pronouncing language, and children who have hearing impairment. So because they have difficulties or barriers to hearing, that causes an impact on their language development. So there are other kinds of developmental disorders children can have, like say attention deficit disorder, but these don't really cause concern for language learning. So the ones that do cause concern for language learning, the issues that arise when it comes to bilingualism have to do with whether children with such disorders really have the capacity to learn two languages. So the idea behind this concern is that, well, gee, this child has difficulty learning language, so if they're having to learn two languages, aren't we making their life even worse or more difficult for them? And people have thought that maybe their long-term outcomes in their language development in general will be worsened by having to learn two. Like suppose they learn two languages not half as well as if they had just concentrated on one. So it's a widespread belief, and we actually have a little name for it. It's called the cumulative effects hypothesis, or double disadvantage. So there's all these labels that have been put on this concern about capacity. But all the research seems to say that this is not true, that children who have developmental disorders, either directly affecting language or broader disorders that affect language along the way, in either case, it does not worsen children's outcomes to learn two language instead of one. It doesn't make their ultimate language learning outcomes worse. Bilingualism doesn't change or exacerbate anything about their disorder that, say, is non-linguistic. For example, it doesn't diminish intellectual progress or cognitive abilities in children with intellectual disabilities. It doesn't make some of the non-linguistic symptoms of autism worse. None of those things are true. So in many ways, it does make me wonder sometimes why we cling to this concern about capacity when it comes to children with developmental disorders and language learning. Bilingualism is not a disadvantage for them at all. But the flip side of that is that many people have noted that children with developmental disorders struggle in their learning of two languages. But in my experience and in my research knowledge, I think what this really has to do with is not capacity, but opportunity. So many children who have developmental disorders, they get often diagnosed either from birth or in the preschool years, and then the therapy commences. If we're thinking about a situation that most bilingual children in the world are in, which is a migration situation. So you have a majority language of the society and the host society, and then you have a child whose family speaks a minority or a heritage language. Most of that therapy and the medical system and the testing and the intervention, all of that is going on mostly in the majority language in most cases. So these kids get a huge dose of that majority language earlier and more intensely than their typically developing peers. And this can compromise their ability to fully develop their heritage or minority language. So it's not like they can't learn that heritage or minority language or that it's holding them back. It's that they often don't have the opportunity to do so. Another way in which children with developmental disorders are often prevented from continuing their bilingualism has to do with kids who are not bilingual to start. Say they're monolingual, they have a developmental disorder, but it's thought that they shouldn't take second language classes at school, or it's thought they shouldn't enter dual language programs or have the opportunities to learn a second language through schooling, through immersion. And this can be highly compromising to their long-term outcomes. In many places in the world, being able to learn a second language is extremely important, even for the most minimal form of employment. I'm thinking that English is a growing lingua franca across Europe, and even for some basic jobs, especially in tourist-oriented places, knowing a bit of English is really important. So if you organize a child's schooling such that their language therapy is held instead of, say, English foreign language classes, you're compromising that child's future. And very, very often this is done through a mistaken belief that, well, language is really hard for these children. So the best thing we can do is keep them away from a second language class and keep them only with the majority language. So in both cases, children who are bilingual, not by choice, but by circumstance, because they're heritage speakers, and children who are monolingual, but could, like with their peers, benefit from second language. In both cases, their ability to continue bilingualism or become bilingual, can be compromised by these mistaken beliefs that they have this limitation, this capacity limitation. And I've spent so much of my career fighting against these myths and trying to convince people, parents and professionals, that bilingualism is a healthy path, and it is, especially for children who are heritage speakers, it's the most important path. A child who is growing up speaking a heritage language and has a majority language in the community, bilingualism is not a choice; it's a necessity.
Well, Johanne, I'm totally enchanted hearing you because I think not only because I know your research, and ever since I've been, let's say, younger, I followed your work with lots of admiration. But I also wanted to thank you by how clearly you've actually helped us, demystify this idea, right, that bilingualism can be harmful for children with some type of developmental disorder. So I want to really thank you for your work and for doing that, and for your dedication and your generosity. And since we have you here, I was wondering if we could ask you, since we really think you are the best person to ask. And I know this is a big question, but what type of recommendations, since I know that you've also, have been fighting the good fight for so long, what type of recommendations would you have for like parents and practitioners, educators? I know this is a big group, but in order to help us, right, as of course, like on the one hand, people who are involved in the day-to-day life with these children, but also as a larger society, what can we do to actually move towards the path in which we embrace bilingualism as something that is empowering and we can best support these children? Do you have any recommendations for us? I'm sure you do.
Oh, yes, I have some recommendations. I think I'll start with parents and then move on to recommendations for clinicians and educators. So, and if if I get carried away with the parents, don't let me forget to talk about the clinicians and educators. So I think that parents, and there's quite a body of very rich research, interviews with parents of children who have developmental disorders. In particular, there's a lot of research on parents of children with autism on this topic about their beliefs about their child bilingualism, their experiences with professionals, and what advice and what their own thoughts are about language use in the home. And one of the things that this rich body of research has taught us is that parents get all kinds of very concerning messages about how to raise their child at home. So I would say, most studies, and these studies take place in Europe and in North America, that parents receive advice from either family members or professionals to just stop raising their children bilingually. That is really common and widespread. It's not universal, which is nice to know, but it is common. And this causes a lot of distress for parents, especially parents who are first generation immigrants who are not, may not be proficient or fluent speakers of the majority language. And they're told, oh, you've got to only use the majority language at home. And if you think about the logistics of it, what if they have other children? What if they have other family members? How do you isolate one language from the other in the home only for one child, but everybody else is bilingual when you think about it? And I raised my two kids bilingual. And if anybody listening who is in a bilingual home, you know immediately, well, how on earth would you actually do that? So it's not even practical. But parents who have children diagnosed with a very serious disorder, it's like a trauma. And so there's a lot of distress in parents when the diagnosis comes down and they realize what has to happen, and suddenly there's hours of therapy, and so they're distressed, and then you're giving them this really impossible task about managing their languages at home. But because of that distress, a lot of parents try to follow this advice, and so sometimes what happens is they try it. They try to only use the majority language, and then they realize they can't. They're too constrained. They can't speak naturally or freely with their child. And what about their other children? And then they feel like failures. They feel like they're doing their children harm by using the heritage language. So it creates a lot of emotional problems in the home to make this advice. And sometimes the professionals who give this advice, very often, especially in North America, they're monolinguals. And they have no idea what they're asking these families to do. And so they're really, in essence, what they're asking the parents to do is something unnatural, impractical, something where they'll be giving their children less rich language input because they don't speak the majority language very well. And all of that is really bad stuff and should be avoided. However, we continually get reports of parents being told. And sometimes, you get mixed messages to parents too. You get the speech language therapist says, no, it's okay to be bilingual. But the pediatrician says, no, bilingualism is bad. Or the occupational therapist, or, because a lot of kids who have complex needs have professional teams. So then parents often say, well, when they're getting mixed messages, what do? And then auntie so-and-so from their family is really pro monolingualism. And so you throw a nosy family member in the mix. So all of this basically boils down to unnecessary complexity and difficulty for parents, and parents who already are struggling with the emotions of knowing their child has a lifelong disorder are then racked with guilt for, I can't give my child the best language that they need. So all of this to say that what parents really should be doing is ignoring that advice to turn their home into a semi-bilingualism zone. I've even heard parents who were told, well, maybe you can speak your heritage language, but only on the weekends. Just keep, things that are impossible, or pick one room in your house and that will be the room for the heritage language. Like anybody who lives in a bilingual house knows this is impossible. That it's impossible. So what parents really should be doing is giving their children the richest language input they can possibly give them. And that means speaking the language parents know best. right? And if parents are equally fluent in both languages, this is a non-issue. But in many migration cases, it isn't true that parents are equally proficient in both languages, right? So, so by rich input, I mean doing all the things we would do with typically developing children, giving them rich discussions, book looking activities, asking them questions, very often supporting the language of children who have developmental disorders in any language requires doing things like scaffolding them. So say they say a very short sentence or one word and they say it's like truck, and they pointed a truck, and then you create a whole conversation around that. Oh, do you want to play with your truck? Let's go. The truck goes vroom, vroom. What color is that truck? And you kind of build around the limited language they might be using. Most children with language disorder have language delays, and they're often not using big, long sentences at the ages that typically developing children do. So they need a lot of this scaffolding. And it helps them learn language, and it doesn't matter what language you're doing it in, as long as you're doing it. The other thing I would tell parents is be open to code mixing the two languages together. All bilingual children do it. It's not a bad thing. It's not something that should be corrected. In fact, in many ways, children are stretching their communicative resources by putting the two languages together. And so I've heard many parents told that they should ban code mixing. Like they're told it's okay to speak your heritage language, but don't mix the language. That'll confuse your child because your child has a disorder. It doesn't, there's no evidence it confuses any children. Disorder are typically in all bilingual children code mix. So code mixing is fine, and should be just part of the, getting your child to speak and use language and using language with them. So when it comes to the professionals, like the educators, teachers, preschool educators, speech language pathologists, school psychologists, pediatricians, for those folks, I think that, the main thing is to, first of all, do not tell parents to stop speaking their heritage language. That is a mistake. It's built on a myth and a misconception, and it is not helpful. But I also think that, judging from the parent reports in the interview research, parents need strong pro-bilingualism messaging from professionals. So it's not okay to tell parents, well, if you want to keep speaking your language, fine. But I am only going to support the majority language because that's what I'm trained to do, and that's my job. That kind of messaging does not encourage parents. It just makes parents worried and to second guess their choices of continuing to speak their heritage language. So say special education team, or the by that I mean the umbrella for all these professionals I mentioned, they should all be on the same page. They should all be giving pro-bilingualism messages, and they should work directly with parents about how to use the heritage language. So parents are often given homework to do at home with their children to support their language, and professionals should help parents adapt those materials and that homework for the heritage language. And you can do that without speaking the language, because you just talk to the parents about what the concepts are behind the homework that you're giving them, like do these activities, do this book looking, do this question asking, do all these rich language interactive activities, and then ask the parents, so if you're doing this in your own language, how would you do it? You talk a bit about that, and just go from there. Involve parents actively in producing the bilingual environment the child really needs. There's even research to show that this can be very successful, that parents can be useful partners in intervention, and as long as they're brought in with the idea that they can help and they should help, and with some pointers for how to do it in their heritage language. I mean, obviously, if you have very specific language targets, like some verb forms in the majority language, you might not be able to get parents to do those in the heritage language if you don't speak it. But there's so much else that parents can be doing to support both languages of their children. And this needs to be done. I think that I always tell speech language therapists that, bilingualism is part of that child's core communicative needs. If you're supposed to be servicing that child's communicative needs, bilingualism is not an option. it's on the table, it's always on the table, and it has to be a core part, a fundamental part of any special education or intervention plan.
Well, Joanne, this was so enlightening, and I think also so useful, because not only you provided this comprehensive overall summary of years and years and years of research, but you really provided like good recommendations. And I think it comes to what you said at the beginning, right? First of all, providing opportunities, meaningful opportunities for these children, for their families, right? And also, I think pushing our societies to understand that bilingualism, multilingualism is an inherent part of our experience as human beings, right? And the moment you take that away from someone, you're almost like devoiding them from their humanity somehow, right? So I think this was beautiful. This was super useful. And I really want to thank you for all your insight, for your time, for your generosity, and for your work, and for helping us all understand better the role of bilingualism in children with developmental disorders, for the work that you do with the community to spread the message and support these families and these children, and also for helping all of us understand better bilingualism, the cognition behind it, and also for helping so much, empowering bilingual experiences and bilingualism. Thank you. It was an absolute pleasure and a gift to have you. Thank you, Johanne.
Thank you so much for giving me this opportunity. This is a topic I'm very passionate about, and I could go on forever about it.
We would have you going on forever about it. It would be great. Thank you, Johanne, for your time so much. Thank you. Bye-bye.
Thank you. Bye now.
We really hope you enjoyed our ninth helping question, and that Johanne's fascinating scientific insight and professional experience helped you to better understand the importance of fostering and empowering bilingualism and bilingual language development in children with developmental disorders, and learn some concrete and valuable ways about what we can all do to support child bilingualism in clinical populations inside and outside of the family context. Stay tuned for our next episode coming to you on April 28th, where we'll get to ask Professor Dave Miller, Assistant Professor of Spanish and Linguistics at the University of Illinois in Chicago, United States, our 10th helping question. Are there any ways in which the languages we speak affect the decisions we make, the judgments we make, and our behavior? We look forward to seeing you all back here on April 28th. Also, do not forget to subscribe and to share with us our thoughts, feedback, and comments on any of our social media channels. Thank you for listening, and we look forward to seeing you back here for our next helping question on April 28th. Bye-bye.